door for patient privacy. Hi, my name is Mallory and I'm a student nurse and I'm going to be changing your dressing. Can you please verify your name and birthday for me?
Natalie Walters, 841.
Okay, wash my hands for infection control. Do you have any allergies at all?
Amoxicillin.
Okay, I'm verifying with your wristband and a doctor's order. I'm gonna raise a table and the bed. I was in here about a half an hour ago. I'll give you some pain medication. Can you please rate on a scale of 1 to 10 what pain you are in right now?
2.
Okay, are you okay if I go ahead and do the dressing change then?
Yep.
Okay, great. All right, so first I'm gonna do the push and pull method. Remove the tape. And we are limited on split gauze, so there would be some right there, and I'd remove those as well. I would also look around the drainage site, around the tubing, to see if there is any infection, pus, redness, swelling, and I will do a further examination of that soon. There's some serous fluid on here, and like I said, I will examine more, so I will dispose of this and wash my hands. And then I will start by making sure all the packaging is intact and the expiration dates are still current. So I'm going to start, actually I'll do the 9 techniques first. So the first one is limit the sterile technique to the 1-inch border. Limit your time the sterile field is open. Water flows in the direction of gravity, so keep your arms up. Never, if you break sterile field, be honest about it and know how to correct it. Never turn your back to the sterile field. Skin is not sterile, nothing below the waist is sterile, and sterile water goes in the sterile bowl. So now I will begin by, this is like, to start with the sterile field, I will open this like an envelope, making sure not to cross-contaminate. When I have a corner, I can grab the 1-inch border, dispose of that. That will go away from me. Okay, next I will do the bowl, and this is like a cheeseburger wrapper. Drop it inside the 1-inch border. Next, the tweezers. Packaging with the gauze, alligator mouth. Alright, so next I'm going to whip this liquid, this saline. And it's staying above the sterile field. Alright, so next I will go ahead and put my sterile gloves on. Making sure not to break sterile field. Grab the cuff. Keep my hands up. Okay, and then grab inside this one. Alright, so now that I have my sterile gloves on, I can start by arranging my sterile field. I'm going to drop the gauze in the saline. Alright, so I'm going to contaminate my left hand, hold the tubing. Clean this half, and I don't see, I said I would further assess, I don't see any redness, swelling, or discharge more than normal. Hold the tubing, clean this side, dispose of those. So next, we'll drop the split gauze. This hand is contaminated, so I'll put that one behind and grab the ABD pad. Now I can take this hand back out and use the push and pull method, push down and then tape everything up. And then I will clean up all my supplies, my sterile field. Is there anything else I can do for you while I'm here? I have time. Remove my gloves, wash my hands, and then close the door for patient privacy. And then I would also come back in a little bit to make sure that the patient's still doing okay and everything's good, just not a further assessment, I'll also document that I changed the dressing, and then that is it.